This tablet is a combination of vitamins and iron, which is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for the body and help maintain good health. It is important to take this tablet as directed by your doctor. Typically, it is recommended to take one tablet daily with a glass of water, preferably with a meal to maximize absorption. Talk to your doctor about the best time for you to take this medication. When taking Century 18 mg to 0.4 mg tablet, it is best to take it by mouth, usually once daily or as directed by your doctor. It is important to follow all directions on the product package and not to take more than the recommended dosage. It is best to take this medication on an empty stomach, 1 hour before or 2 hours after meals, with a full glass of water. If stomach upset occurs, you may take it with food. Avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they may decrease its effectiveness. It is also important not to lie down for at least 10 minutes after taking the tablets or capsules. If you are taking the delayed release form or extended release capsules, swallow them whole and do not crush or chew them. Taking this medication regularly at the same time each day will help you get the most benefit from it. If you experience constipation, diarrhea, or upset stomach, don't worry. These effects are usually temporary and may go away as your body gets used to the medication. If they persist or worsen, contact your doctor or pharmacist. Iron in this medication may cause your stools to turn black, but this is not harmful. Your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. And remember, in the US, you can call your doctor for medical advice about side effects or report them to the FDA. In Canada, you can call your doctor for medical advice or report any side effects to Health Canada. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children under 6. It is important to keep Century 18 mg to 0.4 mg tablet out of reach of children. If an overdose does occur, it is crucial to seek medical help immediately or call a poison control center. Before taking Century 18 mg to 0.4 mg tablet, it's important to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. Also, discuss your medical history, especially if you have iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems. If your multivitamin also contains folic acid, let your doctor or pharmacist know if you have vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency. It's important to inform your doctor or dentist about all the products you use before having surgery. If you are pregnant or breastfeeding, be sure to consult your doctor before using this medication. It's important to be aware of how Century 18 mg to 0.4 mg tablet may interact with other medications. This could affect how well your medications work and increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This product can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's best to separate your doses of these medications as far as possible from your doses of this product. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. Keep in mind that this medication may interfere with certain lab tests, possibly causing false results. Make sure lab personnel and all your doctors know you use this drug. If someone has taken too much Century 18 mg to 0.4 mg tablet and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. You can call 911 or your local poison control center for assistance. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important to take the recommended dosage of Century 18 mg to 0.4 mg tablet and seek medical attention if you suspect an overdose. Always keep the medication out of reach of children and pets to prevent accidental ingestion. If your doctor has prescribed Century 18 mg to 0.4 mg tablet, it is important to follow their instructions and not share it with others. It is also important to attend all medical and lab appointments as scheduled. Some brands of this medication may contain additional ingredients such as docusate. If you have any questions about the specific ingredients in your brand, be sure to consult with your doctor or pharmacist. Remember that Century 18 mg to 0.4 mg tablet is not a replacement for a balanced diet. It is best to obtain vitamins and minerals from healthy foods. Be sure to maintain a well-balanced diet and follow any dietary guidelines provided by your doctor. If you are prescribed to take Century 18 mg to 0.4 mg tablet and accidentally miss a dose, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed one and take the next dose at your regular scheduled time. Don't take a double dose to make up for the missed one. When taking Century 18 mg to 0.4 mg tablet, it is important to store it at room temperature, away from light and moisture. Be sure to keep it out of reach of children and pets, and do not store it in the bathroom. When it is expired or no longer needed, make sure to properly discard the product by consulting your pharmacist or local waste disposal company. Avoid flushing the medication down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.